Hi, I'm Dr. Hazwani. So, you want to be a general practitioner? Actually, a general practitioner is a doctor who work in a primary care setting. So there is two types of GP doctor. First, they have their own clinic like me, and second is they're working in other people clinic. They call resident GP or permanent resident. So as a GP, the doctor will treat patient based on a symptom, clinical symptom, and usually the patient came first time for you, so you have clueless of what patient complain. So after they complain, and you must do the history taking properly, and after that, when you are thinking some of that diagnosis, you have to rule out one by one until you get the confirmed diagnosis. To get the confirmed diagnosis, you need to do some investigation such as physical examination, blood checkup, or any other procedure like X-rays or any other procedure like pap smear to confirm the diagnosis. So for me, as I have my own clinic, I can schedule myself according to my time, my free time, and I can choose what time of my practice hour. So for the first year, I'm working a full day from 8 a.m. to 12 midnight. So including public holiday and also weekend. But after 1 year, I've been hiring a permanent resident, and I choose my time in the evening because my patient always come in the evening and at night and also the weekend. So I take the weekend for full working from morning until night. As a daily basis, I enter my clinic at 5 p.m. and first thing first is my staff already list appointment for patient to come and see me, and I just follow the appointment time with my patient, and they came, I assess them. Usually I'm doing the pregnancy checkup monthly or 2 weekly or any other blood wellness package, and also I do the medical checkup and also the wound management for my patients. Okay, first you must have a SPM level or A level, and after that you must pursue to matriculation, and after you finish the matriculation or A level program, you can enter the medical school. And this medical school is you can choose whether you want to enter a private college or any if your good grades in your A level or matriculation, you will be offered a scholarship to pursue your medical school in overseas, over the Malaysia, or in Malaysia, inside the Malaysia. And the medical program usually consists of 5 years, 3 years for the theory, and 2 or 3 more years in the clinical phase. After you complete a medical degree of MBBS for 5 to 6 years, you must enter the housemanship program in Malaysia. I'm talking about in Malaysia, and the HO-ship is for 2 years. So within these 2 years, you must enter or working in 6 departments for 4 months. And inside the department, you are called as a junior doctor, where do you still work under supervision, and also you still have assessment like Viva or multiple choice question and exams. After that 2 years, and then you must take the compulsory service with government hospital for another 2 or 3 years, and after that you can quit from the government because you already have an experience in government setting, so you can open your own GP clinic, or you can work in other clinic as a resident GP or permanent resident. First, I always talk to my junior doctor, you must have a good attitude. So this is very important. Good attitude can lead to be a good doctor. And I always advise my junior doctor to be a 7-star doctor. So they must have a good attitude, discipline, they know how to manage their time wisely, and they know how to communicate with their patient well, using the comfort words, using the soothe word, and how you advise patient regardless of age that came to you. Even though your patient is older than you, or even though your patient is younger than you must know how to communicate, and if there is any bad news to break, so you must know what is the best way to break the bad news to your patient. If you are really interested to be a general practitioner or GP doctor, you actually have so many opportunities depend on your interest or depend on your specialty interest. So there is like GP clinic with aesthetic, GP clinic with antenatal, and GP clinic with occupational health doctor. So you can take some certificate after you have MD. You can add on your certificate as a value added. So you can open the GP with OHD, and you can do a medical checkup to like offshore worker. You can go to any other factory. Being a GP is not really inside the clinic. You can go out actually, and there is so many opportunity. And some of the GP also become a celebrity doctor. They appear on TV, they appear on YouTube channel to educate people, to advise people regarding health. And also some GP also be a fitness trainer, and also some GP also be an entrepreneur, and they are open their own clinic, and they are be a businesswoman or businessman. If you have a money-minded, so GP is not giving you a very high salary, but as a fresh grad, I can tell you that you will earn about 5,000, and after you confirm being a fully registered medical officer, after you complete your housemanship, and your salary will increase up to 7,000 to 8,000, and if you have master degree, you will become a specialist or you will become a consultant, and your salary will increase up to 10 to 12K. And if you become a general practitioner, you're working in other people clinic, your salary will be range about 8 to 10K. But if you have your own clinic, is actually your salary is up to you. Something is when your patient is so high expect on you. So it's actually your title makes you you hold a very high responsibility because of your title, and this make people meet you, and they have high expectation. So if you don't meet their expectation or their hope, you will feel some disappointment. So that is what I feel, but actually you can counter patient, and you can manage patient well if you have good communication skills. There is so many best things about my job actually. First, if you are one who really cares about the title, so the title make you become slightly famous, because everywhere you go, people will acknowledge you as, oh yeah, doctor, and your people will respect you more actually with the title. For me, the title is not really concerned, but when people know you, especially my patient, and my patients somehow now become my friends, so you can meet new friends. From patient to friends relationship, and also when you go to anywhere nearest your clinic, so you can get some token of appreciation. So they can treat you, and they can give you free food, they can give you presents. So even though they say thank you, you will feel like, wow, I'm so grateful that I'm being a doctor. So if you are really interested to become a GP, I really welcome you, and also I advise you to study smart, know your ambition, what you want to be, and know your passion towards people. If you're really passionate toward people, and if you really love to comfort people, to advise people, and you can enter our medical life.